Hi, this is Tom Maxson, LMBT, here at Bodywork Therapy Seminars in Cary, North Carolina. I wanted to answer today a little bit more about my massage and reflexology for high performance feet class. That's a very big title and sounds complicated, and there's a lot of good information. It's a little bit technical and intricate, but it's going to be a lot of fun. We are going to dive into some postural analysis and how to see what's going on in the body based on principles of reflexology of the foot. How can we see markers and indicators and wear patterns, strain patterns on the feet of somebody who uses their feet a lot, who's very hard on their feet on a daily basis. Whether they're training for some kind of athletic event or they're first responder, a nurse, somebody in work boots who's on their feet working hard all day. We're going to try to help them, try to figure out where in the body things are possibly going wrong, and then apply some reflexology principles to help them relieve pain, create balance, and minimize the stress level throughout every system of their body, which is kind of the secret of reflexology compared to a lot of other bodywork modalities, is that we can directly benefit all of the systems of the body instead of just looking at the musculoskeletal system. But on that note, since reflexology is such a big, expansive topic, and we have a 6-hour class. In this case, we are going to look at just mainly the musculoskeletal system, again, because as massage therapists, that's what we're already aware of most of the time. That's what we're looking at. That's what we're familiar with. That kind of terminology makes a lot of sense in terms of myofascial, postural assessment of the body. And I'm going to give you some tools to look at the feet, look at the legs, and help kind of unravel some of those consistent issues that come up with clients. Plantar fasciitis, for example, is a big one that we're going to talk about at length. A lot of people either are diagnosed with it or they self-diagnose something that is foot pain, but it's not exactly plantar fasciitis. And people come to a massage therapist and think, if you just beat it out of me, if you just hit it hard enough, I'll grit my teeth and go through the pain to get rid of the plantar fasciitis because it is so painful. And to me, that's the total backwards way to look at it. If somebody has pain in an area and they're vulnerable and there's damaged tissue in the heel of the foot, why would we come in and start pounding on that thing? I want to look elsewhere. I want to look everywhere else in the body. And the foot, based on reflexology principles, is telling us that the hips and low back need to be more mobile, more balanced, strengthened in some cases. There's a lot of information that we can get by looking at the foot, moving the foot, and gently manipulating the soft tissues of the foot in a way that's going to bring a lot of benefits and relief to our clients without having to use our muscular strength and work really hard and pound on their bodies. So is this a sports massage class? A little bit. Is this postural analysis? A little bit. Is this myofascial release? Some. There's a lot of different disciplines that I'm going to pull into this topic that we're talking about. High performance feet can mean a lot of things. What is performance? Balance, agility, endurance, raw strength, repetitive stress. There's so many things wrapped up even in just that one word, performance. So as we get into this topic, I know the class is going to keep expanding, and each group of students who come in and take the class with me are going to be driving that conversation. I want to come to you and give you tools that you need for your clients, the people that you are in reality dealing with and trying to help every day, and give you some maybe some more options for them that they haven't ever heard before, and some different perspectives, because there is so much information from the reflexology world, even from physics now. Ground reaction force studies are fascinating. There's all kinds of good information there coming out about how we interact in 3 dimensions with the world around us. We've got all kinds of different terrain, and our feet are full of nerves, and those nerves tell us, are we safe? Is this a slippery surface? Are there pointy things that are going to hurt us? Are there unknown things? Is it wet and muddy? Is it, there's all this data that's constantly going top to bottom, brain to feet, feet to brain, brain to feet, making real-time adjustments in how we interact with the world. And as we tap into that in manual therapy, how can we communicate with the brain that the body is in a safe place and we can relax and balance and help our clients achieve their goals for whatever they want to do, whatever performance means to them. We're going to give them some options to achieve that in a clear way. So I'm going to put some links in the comments here about how to find the class schedule if you're interested in this topic. I'm Tom Maxson, LMBT, and I'm teaching this through Bodywork Therapy Seminars in Cary, North Carolina. Thank you for listening. I look forward to hearing from you, and let me know if you have any other thoughts about what we could talk about in this class, or topics that you think are important to you and your people who you're trying to help. Let me know. I'd love to hear from you. Thank you.